The ESC guidelines are developed to ensure that health professionals deliver evidence-based care.
But how do these guidelines impact on the patient experience? Mrs. Clark is a 63-year-old lady presenting with atrial fibrillation. This is her story.
It's very frightening to be told that you have something wrong with your heart. One minute I'm in the GP surgery and I'm having my pulse taken, and the next minute they tell me they're going to refer me to the hospital, just so they can get me checked over. Well, I know what that means.
The trouble these days is that everybody likes to think they're an expert, don't they? Whatever happened to Doctor Knows Best? I blame the internet. I don't like the patient second-guessing me, and if I'm very honest, I don't like the nursing staff doing that either.
As far as I'm concerned, nursing isn't just about being caring and compassionate with patients. It's also about being diplomatic when talking to doctors. You know, you don't want them to feel undermined or like their professional competence is being questioned. That's why I'm a big advocate of using the guidelines. They empower nurses like me and allied health professionals when it comes to treating patients.
Anyway, I go along to the outpatients department, and the nurse there, oh, she was lovely, which is just as well, because she said to me, she said, "Your heart thing, that isn't a real worry, not right now. No, the real worry is that your heart condition increases your risk of a stroke." Well, I went really dizzy. I thought I was going to have a stroke right there and then. She had to get me a cup of water.
Well, the latest tools for predicting risk allow us to be much more accurate with low-risk patients, like Mrs. Clark, and that can be very reassuring for them.
Anyway, she says that I'm at very low risk, so I don't need to take anything for it, not even aspirin. And I'm quite relieved about that, you know, because I've never been one for taking things. Not even aspirin, because aspirin, you know, well, that's no good for your stomach, is it? Anyway, I don't need to worry about that now.
So when I tell the patient that she does need to take aspirin, she says that's not what the nurse said. And I think, thank you, nurse, for making this harder than it needs to be. We're supposed to be on the same team and giving the patient consistent information.
I didn't tell the doctor about not wanting to take aspirin, because you don't say no to a doctor, do you? I trusted in what the nurse had said to me, but now the doctor was making out as though the nurse didn't know what she was talking about. But then again, did the doctor know what she was talking about? I had to have another cup of water.
I'll bet the same thing happens where you work. Some of the nurses think they know better than the doctors. Am I right?
I've always been confident enough to say when something's been missed. Never mind, that's not my job, or Dr. So-and-so won't be happy. Would you be happy if you knew a patient was leaving a clinic or a ward and they didn't have the right prescription? No, you'd say something. Even if the doctor wasn't very approachable. You would, wouldn't you? Of course you would.
Fortunately, I'm a very approachable person. So when the nurse told me that these were all updates to the guidelines, I was more than happy to hear about it.
Along with the recommendations for new oral treatments, post-treatment therapies, new approaches to drug intervention, and the screening advice we've been giving to primary care nurses.
Well, I didn't know the guidelines had been updated. I mean, there's so many to keep on top of these days, it's easily done, isn't it?
If you see something that doesn't look right, you've got a duty to ask about it. It's as simple as that. Especially when you've got evidence-based guidance backing you up.
So the doctor said that she'd spoken to the nurse and that they'd reviewed my level of risk, and they decided that I didn't have to take aspirin if I didn't want to. So I said, "Are you sure? Because the last time I spoke to you, you said something completely different." And she said, yes, I'm absolutely sure. You're at the lowest level of risk that you can be. So that's very good news for you. Oh, well, I was really pleased with myself when I heard that, and quite relieved, because it is a relief to know that the people who are looking after your care are talking to each other, and they're listening to each other as well. But even though they've given me the best possible news that they can, it is still a shock to know that I'm living with a heart condition. And it's very important for the medical people to know. Very important for the medical people to know. It doesn't take a lot to get me very, very upset. Very upset indeed. But at least now I know that my heart is in good hands.
So on reflection, how do you think Mrs. Clark felt during that situation?
What are the main issues facing Mrs. Clark and the clinical team looking after her?
And what would you do differently to avoid the situation?